think I'm waiting for the clip on. Okay, so welcome back, everybody. I've just juggled the agenda very slightly because Carol has to leave us at 11:45. So I've moved her report, which is item 22, the verbal report from the Mental Health Joint Committee, to just now, so that she can give that report and then go with a clear conscience. So, Carol, over to you.
Yes, thank you very much, Angela. Thank you for shifting the agenda around. And just to note that there is a written report that has gone to the ICB on this same item. So what I'll do is just pick out some headlines from that, but we might want to circulate the ICB report to give the fuller version of this should people want to see it. So overall, the last Mental Health Joint Committee meeting was held on the 13th of August. No alerts raised, but we did receive a summary report about the revised government arrangements, because if you recall, there was a review of the collaborative, sort of reflecting changing conditions in the environment and everything else that was going on. So that's still really being worked on. We're still a discussion about the terms of reference and really keen to shift from transactional commissioning to a strategic oversight. And we really need to make sure that we've got a clear articulation of our mental health strategy risks. So that was really the part of what we were thinking about, but very much more that there's work to do. On finance, one little piece of good news, really. The mental health investment standard has been set for our system at 4.5%, which exceeds the national minimum. So I think we're pleased to see that in place. £2.7 million cost pressure noted, mainly from Section 117 placements. I won't go into those in any more detail today, but understand that there are mitigation plans being put in place. We also had a discussion about the 10-year plan and the implications specifically for mental health. And again, that will be an ongoing conversation. We know there are some national guidelines around specific developments and expected timescales for delivery. So we're working on those through system planning. And on the assurance side of things, programme performance, strong results in children and young people access, perinatal recovery, and as we've already heard, the out-of-area placements. I think the other thing that we heard was from the programme board on progress on the acute inpatient strategy, suicide prevention, and the Safe Haven review. So we covered a fair amount, but like many of our other committees at the moment, some stuff is up in the air, but I think we're just trying to make sure that we can keep a focus on both national developments, but also on what's right for mental health in Herefordshire and Worcestershire. Sue, is there anything you wanted to add?
No, I think clearly you've highlighted the issue around Section 7, which does need to be better understood, because obviously that can end up being quite a sizable current pressure for us in a climate where we no longer have the mental health investment standards. So just to note clearly that will be a focus of the upcoming meeting.
Thank you. Thank you for that, Carol. Thank you, Sue. Any questions? Okay, thank you very much, Carol, for the report, and thank you for your leadership in this area. I think you've got a real advocate for mental health in you, so thank you very much. And we'll let you carry on with the rest of your day as you see fit. And I'll move back to the agenda in the right order now. So the first item is the quality and safety report, and that's Natalie.
Thanks, Janet. So as I say, I'll take the report as read. Just a few things to draw out under the key categories. So patient safety, there's no noted change to incident reporting. The real focus of this work stream is around duty of candour. So we've updated the policy and we really want to make sure that we're working most effectively with duty of candour. We're being open and honest when things aren't right. Clinical effectiveness board will remember that we developed a quality dashboard earlier this year. This was the next stage of that development. So it's now giving us really high quality information about mortality, and that will really help our assurance and an overview of that. Regulatory compliance, we had an internal audit report come to Quality and Safety Committee from the CQC Master of Actions, which found significant assurance, which was really helpful to understand the approach we took was a robust one. Patient relations, the exceptions report here is around the ongoing high level of PALS Act complaints related to children and young people's service delivery unit That's specifically around waiting times, access to services, or not being taken onto services. And we're about to have another meeting with the service area to think of how we could do things very differently, because other things we've put into place haven't had an effect so far. Patient experience, we talked about earlier, care and its final rollout, and then the next piece of work is really around this triangulation of all the ways that people can talk to us about the services. How do we pull that together and make it really meaningful? We know part of the DASH report and the National Quality Board will be around looking at friends and family test and whether that continues. So how do we make this really meaningful and really enhance that patient experience and patient voice? And then really positive to note the development of the quality improvement programme, and a real shout out to that team for the improvements they've made in the last year. Lots of amazing projects coming through Transformation Tuesday, and the real improvements they've done through the CUSA training. So that's just outlined in the report.
Thank you, Natalie. Any questions? Okay, thank you very much. The next item is the actual report on the committee meeting. That comes to me. I just wanted to pick out 2 items for alert, one of which we've heard about already, which is the CAMS LD service. We discussed that earlier. And the other item was a concern relating to Vicky Ward, but we were assured that there was a comprehensive action plan in place. Other than that, I didn't want to put anything else out from that. If anybody has any questions? Should move on quickly then to the workforce report, and Naomi, you're going to present this.
Thank you. So we now have our 3 subcommittees in place which go through to People and Culture Committee, and this report focuses on the particular integrated workforce statistics. So just to bring out, our turnover and sickness absence did slightly reduce this month compared to where we were 12 months ago. Our turnover is sitting about 11% compared to 12% a year ago. Sickness has been a slight improvement, but we're aware that that is an area that continues to need quite a big focus on it. One of the things we're doing is we're really looking at that focus on prevention, and part of that is the new health and wellbeing policy, which is just going through for approval at the moment, and that's very focused on preventing people going off with absence rather than just about dealing when people are off. So that will be a real change in how we do things. On positive news, our vacancies are showing quite significant improvement. We have had a lot more applications, particularly for our mental health nursing roles, and so the volume has increased, but also the quality of those applications has been of a really high standard. So there are a large number of people in that recruitment process coming in to fill those vacancies, and we're just working on getting our data all aligned so we can really clearly see who's in the recruitment process and what that actually leaves us then as a true vacancy. Appraisal rates do remain a concern, and that is one area that hasn't shown improvement at the moment. However, there is a particular focus through integrated governance on local action plans for where those aren't where they need to be, and that is being a particular focus at the moment. Overall, the agency's spend is 370,000 below plan, so as a whole, and that's a positive picture at the moment. And there's a lot of support being provided to staff, particularly in the current climate, and a lot of change management going on. Our health and wellbeing leaders doing a particular focus on supporting staff going through those processes.
Any questions for Natalie?
No questions for Natalie.
Sorry, not Natalie.
Be directly over to Harry.
Let's just throw it round. Oh dear. No questions. Fancy having 2 people with names beginning. Okay. So in that case, I'm going to to move over to the lady that I did refer to as Edna at one point.
I just a little giggle about that. I have to say,
I've been called so much worse than just for clarification, I think it was some sort of auto threat, but it did make us all laugh. So Zena, would you like to cover the
So you've obviously already had the operational update from Naomi, so I'm just going to focus purely on the committee's assurance view and the areas of risk that we need to be aware of as a board. Committee received assurance in respect of several areas which Naomi's taking. We took good assurance on culture and engagement. The pulse survey participation has been strong. The culture score is showing a sustained positive trend. It was also really good to hear that preparation is already underway for the forthcoming National Staff Survey. Can you believe that's already coming around again? We've also noted the improving vacancy and turnover data in some key areas. Also really good to see that we've had 9 HR policies that have been approved, with the remainder on track for November. We're seeing a real kind of traction in the way our policies are coming through now, which is really good. There are, however, areas where committee couldn't provide full assurance. First year retention is still a concern. So whilst overall vacancies are reducing, that early attrition remains a persistent workforce risk. And as Naomi mentioned, appraisals are also still an area of concern that we're doing more work on. Delivery is lagging, we need a bit more traction. We had a much more detailed discussion around EDIE. It is an area of concern. We had a thorough and really helpful presentation from our EDI lead in relation to the RES and DES reports. And there's some encouraging signs. We got our reasonable adjustments process in place, guidance is in place, networks have strengthened. We have fair recruitment in many areas. Board disability representation has increased, board diversity in general is strong. But there's some key areas where we are falling short. People from ethnic minority backgrounds are still nearly 3 times less likely to be appointed after shortlisting in posts at band 8A and above. They are nearly 4 times more likely to face disciplinary action. Disabled staff and ethnically minoritized groups continue to report disproportionate bullying and harassment. And there's a really significant gap between disability declaration rates and survey data, which seems to signal a lack of trust in disclosure. I mean, those are all areas that we need to be looking at. And so the EDI subcommittee is leading targeted work in those areas. So Naomi, along with our EDI lead, Sue, Andrew possibly, they're going to be working together to provide progress reporting so that we can track change over time, and that will return to PCC. In terms of future reporting, board will have seen from the redesigned performance reports aligned to the new metrics that our lowest domain is people and workforce, particularly around sickness absence, staff engagement, speaking up. As Sue mentioned earlier, she was nominated and informed that she's going to be spearheading a task and finish group in relation to those metrics for the 3 main committees, including PCC, so that we can measure and see, how our interventions are actually making a difference for staff. So we will obviously continue to focus on those risks with the aim of bringing sharp impact.
Thank you, Gina. Questions, Jill?
Yeah, as we'll probably see later on in reports considered elsewhere, on the RES report, one of the things that I think we as a board need to demonstrate leadership is actually, whilst our board diversity is very positive, actually that's not recorded accurately on ESR. And so it's probably an opportunity for everybody to review their own personal ESR record to check that we're demonstrating that we are leading the organisation by actually recording details about those various characteristics that are on there, because in the data as demonstrated in the RES report, we've got a disconnect between what's on ESR and actually what people report elsewhere. And so we probably all need to just reflect back on, have we all done what we're asking our staff to do in reporting?
Thank you for that, for Jill. I think that's a useful reminder. Scott.
Yeah, I think it's with the actually no, sorry, I'll cut that a bit.
Okay, right. 4 minutes and 10 topics. I think that's
Yeah.
Just quickly, those positions you outlined earlier, which obviously that's not good news, those various things that you said around race or disability, etc. Are they worsening positions, or are they reasonably stable from last time we measured them? Or by chance, are they horrible but actually improving?
Of course, it's kind of the point I was leading to. So some of the metrics we're looking at, they are annually measured. So with also when it comes into the thinking about the performance report and off position, that annual position. So there's room for quite significant movement there in terms of improvement and decline. So that's in terms of the bit we're talking about there, but also on the NOF. I think that the way we track it in the interim is through the pulse survey. That does give us a feel for improvement and experience. That annual capture is quite a critical point.
So is it improving or is it worse?
Apologies. Yeah, so when you look at the pulse survey, a lot of the metrics when we look via race are improving. The bit which is I can be less confident about is people who are reporting the disability or long-term condition.
Thank you.
That sounds like what we. Yeah, thank you for that, Scott. Okay. Further questions? I'm going to move on then to the bit we've been talking about as well, quite a lot, which is performance report, including the integrated performance dashboard. Robert.
Thanks, Janet. And quite clearly, we've got a new report here for the board. So I'll just take a little bit longer than I might have just to make sure we're drawing out the key points. So a few things here. First of all, just to set out, this is by nature drawing on the national information. So we've got absolute clarity on the board around how we sit against the NOF. So the second point to say is clearly the NOF is not the be all and end all, but it is a very important national measure, and it will be important for us in terms of furthering other strategic aims and priorities that we might have, such as around namely health and so on. So it is incredibly important for the board from that perspective. What we have in front of the board here, actually, you will recognise is slightly different to what went to committees, and that's because this reflects the nationally published position, which was, I think, the 9th of September it came out, and actually is a very helpful dashboard that's been presented nationally, which we've drawn off as the first page, the summary page, where we had a slightly different version. And I'll just come to a few points on that in a moment. The other thing to say is there's been a lot of discussion this morning about how we're going to use this to make sure we've got clarity and line of sight through into committees, and on the points around effectiveness, those are going to be incredibly important. And what you'll see on the second page is where we've lined up against the metrics, which committees that we have with primary oversight, and that's actually always an important part. And kind of the final part to say on the reporting is that we still have a suite of other reports that remain in place to support the activities and operations of the trust, but clearly as a board focus and then to a committee focus, we're trying to draw it in. So remember the integrated performance dashboard that we haven't got in detail, that is still there, that's still produced, that still goes up through integrated governance to provide them with the detail. We are just working on a couple of other specific reports, which are actually being produced as well in the national team to support the community level work, which are around particular mental health metrics and some mental health, some waiting list information as well. So those are bits that we're expected to drop as well. Final part to just say on the format. In terms of what we have at the board here, we've effectively got the cover sheet with the summary and then the two key pages, which is the national position, then the slightly more detailed assessment of how we score against the domains. For the committees, just so board's aware, what we have is we have an individual sheet for each of those metrics, which we will then tailor to the committee. So the committee won't have all of the sheets, it will have the ones for the metrics it's got. And again, hopefully the intent with that is that gives real clarity and focus for the committee in terms of off metrics. So those are things to draw out. Just a little bit on the oversight arrangements and framework, then just clarity for board. As Ellen said earlier, we've had the first formal segmentation where our trust has rated as segment 3, which is there. I'll just draw out a little bit about that. The national process is set out to run on a quarterly basis, so it will be slightly out of sequence with our board. We'll effectively have an update every 3 months. The next update is due, as we understand it, to be released at the end of November. So the national assessments will happen at the end of each quarter. So this was at the end of month 3 and month 6 and so forth. We are just working through the reporting that we'll put in place for the out of sequence month, if I can put it that way, because I think what we're expecting we'll be able to do is show degree of where we've made progress against the metrics, okay, to board and committee, where we are on that, but just again working that through. And the final piece I want to say, just in terms of context about how this works, which is different and will be important for colleagues and public to understand, is that whereas before we had metrics with a simple threshold and a level to achieve, there's a difference here in that we have metrics where we are compared against our peer group of 62 trusts, mental health community trusts, and you are then segmented into quartiles against that. So whilst we will endeavour to improve against our metrics, everyone else will be improving against metrics, and therefore that will mean there's a little bit of uncertainty around exactly how that's going to play through quarterly reporting. So we just need to bear that in mind. It's not quite as simple as saying that's the level to achieve. So that's what we have there. Just in terms of what we've got in front of us for the report, then I just wanted to draw out a couple of key things on the first of those 2 pages, if I can. So see, we have the actual segmentation quite clearly on the top right, which is segment 3. And then there's a little bit more detail below that, which is a later addition with the national team, whereby there's effectively a subdivision assessment of how we're doing against each of those 5 domains. And I think, as you showed earlier, the most challenged domain is around people, whether are the 2 metrics need to be focused on. Here we have one high performing domain, which is around effectiveness and experience of care, and then we have 3 which are above average, which would kind of indicate or ordinarily be more towards segment 2. The point about segment 3, which Ellen mentioned earlier, is nationally there are 3 financial overrides which apply, and if any of those hold, the highest segment a trust can achieve is segment 3. We broadly there around, are you in receipt deficit, support monies, have you got a surplus or break-even plan? Third one where we were off track at month 3 was, are you on plan against your financial position as of the end of the quarter? So if you recall at month 3, we had a slight pressure on our plan which was predominantly related to the surge capacity. I'll pick up probably a little bit more about. So we were subject to the national override, and we were placed into segment 3. On the report, you'll see that is covered in the second box at the top in the middle. The top left box is probably quite an important one, which just draws out the point around what your overall aggregate scores are across those domains. And probably helpful to look at the graph at the bottom, because that gives you the distribution of all trusts in our peer group of 61. What I probably would just draw your attention to is with the gold one on there, you can see there's a number of trusts to the left of us that actually had a better score, if I could put it that way, but in segment 3. I don't know the detail individually, but it's highly likely they all had a financial override as well. So you can see, looking at this, we're probably on the cusp of a 2 or 3, depending on how much weighting on some scores. So as Alan says, reasonable position to start from, but clearly plenty of scope. And as you'll see, the other element they put in, actually trust ranking in terms of national position, our peer group, 32 out of 61. So again, it gives you a little bit more of a context than maybe had in the past around how we fit against our peer groups. So a lot of information there, but I know I've spent time just running through that. And finally, I just want to draw out, you just flip to the next page, which is effectively a little bit more granular detail for individual metrics against the domain, and it just draws out how we performed against each of those. Again, reasonably self-explanatory, although I and the team are more than happy to pick up people outside for any more detailed discussions, but you can see the metrics that are in the national framework committee for principal oversight assigned them to, and actually how we rate as a trust against that. And you'll see that we've got some strong performing metrics. We've got a number which are well performing, and we have a few that are challenged. Clearly, what the focus will be as we go forward, part of the committee times will be to assess how we're going to make progress against those. Clearly, broader agendas of the committee as well, but this becomes a part of that. I think that's all I wanted to say at this stage. I'm conscious I've spoken quite a little bit, but there's some important points there.
Thank you for that. Yeah, very clear explanation. I think that's really helpful. Do it at the beginning of the process. It's really good. So moving forward, hopefully it will make everything clear. Any questions for Robert? Colin?
Yeah. Two things to say, really, Robert. I like this very much, and I think it's a real positive step forward because it facilitates us monitoring at a much more focused level our progress or areas where we've got to do more. And I know that these are comparative rather than absolute measures, but this format doesn't lend itself to setting a target for ourselves. I don't know whether it's in your sights to do this at some stage, but I think around each of those there would be for us to say, well, we think could be there. We never hear it. Everybody else might get better, but we could be there. So perhaps you could.
Yes, I think as the process evolves, that's entirely clearly some of those it's going to be discussions with teams about whether there are possible what others are doing, and for some of it's going to be about measures, but absolutely that's the intention.
Okay. And the other observation I think is that this is great for those measures, but there are things that we will want to monitor and track in terms of performance that are our priorities. I think if, again, it makes me already insights, if we can get a performance measurement suite of the stuff that's important to us, which is as easy and accessible as that would be really.
Yeah, entirely reasonable. I suspect that probably follows with discussions around the strategy and then what it is we're setting up for next year. As I've said, I suppose the takeaway message I want everyone to understand is there's a number of different reports here that we'll put together, so it's entirely reasonable to put together those key metrics forward. But we start with very detailed, granular integrated performance report, which is able to integrate governance level, looking at the moment and they're in waiting lists. So the off, I think how we draw out the metrics, trust.
No other questions there?
Just a very- are we expecting to see this format every time? So this is now set in stone, so we can, get comfortable with the way that they're presenting the information and therefore start to interpret, analyse as we, or is this just a first cut?
No. This is the intention for the report. Clearly, one of the things I was going to say is I'm more than happy for back outside of the town. Tweak a bit, but effectively this very much mirrors what's available on the national site. I think it's actually quite good. The one bit we're looking to do, Beat, is just we bring something that's helpful and meaningful to the site that doesn't quite fit which show.
And I'd endorse the request that Colin made, which is if we had, the full suite on our radar of different things that we need to do, where we are on each of them. It's a great visual just to see what we're focused on.
Really good. It's really good. Yeah. Okay. Thank you very much. So, Robert, still with you then, the finance.
Okay. I think probably quite encouragingly, as often the case, the finance report actually picks up as I talked about this morning, which you'll probably pick up as I go through. So at a headline level, I'm pleased to say month 4 we're back on plan, which was a really important point, and that really did relate to the closure of that temporary capacity we talked about. So that was a key milestone for us. Clearly, fundamentally important from the point of quality of care. It's also got a significant impact on our finances. And it was that escalation capacity that was the issue around why we were off plan at the end of Q1. In terms of key messages to draw out then, I suppose the first one is that if you look at the underlying expenditure run rate, which is something that we are being encouraged to assess from a national perspective, actually it's been holding steady through the year. So I think that should give us some confidence that where we are is a sustainable position this year. And we've not seen any significant shocks or surprises coming through. So that's helpful. Efficiencies is clearly writ large across the plan, and as it is for all NHS organisations. Again, I'm pleased to report actually we've got good progress we've been delivering through the year today. We're actually slightly ahead of plan, which is encouraging to see. The largest element of that, you'll recall, is around the temporary staffing, and I suppose just to your point earlier, I do think we can take some comfort from what we've seen in the previous years around when we've been experiencing significant pressure over winter or actually other seasonal times. And whilst we see a small amount, it's not something that we generally see as a large increased cost pressure. So I would actually say, taken with the other information you were given as well, reasonably sure that savings we're making and the approach we have is sustainable for the temporary staffing. I think the other thing I'd say on the temporary staffing is we've actually been making some really good progress over this will be the 3rd year. We are now getting much closer to where nationally we're being asked to be in terms of that percentage of overall spend. So that has been good, and that's down to really hard work from our professional teams, and particularly to Natalie, John, and Matthew around how that's been done. So that's good. We are seeing a slight pressure on bank side, but I think I'd be pleased to report to the board that's not just because we're seeing swap out from agency to bank. Actually, we're seeing a reduction overall volumes. We are seeing a degree of swap out as a problem. And then the final part I want to draw out really then is just around programme. It's obviously an important part of what we do. Capital programme is running well so far for the year. We had a full stock take internally actually just at the end of gene caption here, and we're confident that we can go to so
that sounds like mostly good news, which is excellent. Questions? Okay, so Beach, the report on the actual committee meeting.
Thank you, Janet. My thanks to Carol for sitting in as chair on the last meeting, because I wasn't able to make that. But the report in front of you, I take it as read. The only couple of points I guess I wanted to make. Firstly, in the alert section, we've talked about the NOF already, and we're awaiting the national release. But Robert's just been through that very clearly, so we all know what the position is going forward. And secondly, the IT business continuity internal assurance report was provided limited, so obviously that was concerning. But I'm assured that there are a set of actions and a plan that's been put in place to resolve that. So we'll monitor that through FOP over time. On a more positive, as you all know, Rio was implemented some months ago, and we're now into the stage where we're seeing the optimization and the benefits plans being put in place and working through. The committee received and discussed papers related to those, and took a great deal of assurance from those. I think the plans look like very effective. Again, we'll monitor them to be going through in F&P, but that's exactly what Rio was all about ultimately, is the optimization and the benefits. There aren't any other points I wanted to draw out. Everything else in the paper vote I'm happy to do.
Each, any questions for each?
Thank you.
The board.
We've got a lot of territory, but the really only a couple of points I wanted to highlight for the board. There were no alerts, and so that's good news. We spent quite a bit of time discussing the learnings arising from the external audit, and in particular some technical issues that tripped us up a little bit when the audit was being concluded. But that's now firmly in the control of the finance director. We won't have that issue again. I think that's a good progress, really. And that's really all I wanted to highlight at this stage.
Short and sweet. Any questions for Colin? Thank you very much then, Colin. Charitable funds, Sue. You're with us, Sue.
Yes. I am sorry. Colin's report was so short I wasn't ready for getting on. So you've seen the report. It potentially suggests that there are more actions for the committee than there actually are. But just to reassure you, we do think we need some more capacity in the charitable funds space. We're going to work up a business plan which we will bring to the board in either October or November. So it's just a bit of a heads up that at the moment it's quite difficult with all of the efficiency savings that the trust is undergoing to justify giving existing staff time to charitable funds. So we might need to look at a new resource which the charity would be funding and which would have quite a wide remit, including doing some of the administration work which is currently being done by others. Just to let you know that we have brought in a policy that we won't be funding the sort of pens and tote bags and things that in the past people have asked for. We don't think that's environmentally very wise and not great use of charitable money. But you can see in the report that we have done some really good projects, spending quite a bit of charitable funds money in areas where we think it's needed. It says that you're being asked to approve the logo. In fact, you're not being asked to approve the logo because we approved it as the committee. A decision was taken that if we tried to do it at board level, it would just get too many voices. And Mark was at the meeting where we decided that the one we've got is really great. So I've circulated that to the NEDs, and I hope that the directors have had it circulated to them separately. If not, maybe that can happen after the meeting. But otherwise, the investment funds are looking good again, and we are hoping that staff will continue to draw upon charitable funds where they feel that there is a need for some spending which might not otherwise be justified by NHS funds.
Thank you, Sue. Very clear. Questions, Ellen?
So thank you. I just have a thought that's occurred around the proposal of scoping a position, which sounds like a really pragmatic and sensible one, but I wonder if, and I leave it for you to think about, if we could weave something that might be in line with the kind of principles and sort of aims of the charity around that being an apprenticeship for somebody maybe from a local community, or how we could use that role to offer an opportunity to somebody who might not otherwise get an opportunity in our organisation. So just to maybe take that away and think about it.
Thank you, Ellen. I'm sure Sue's noted that. Vina?
Yeah, I was really interested in that pilot, 12-month pilot as well, and I'm sure you'll be having lots of discussions about this, but I think it's important for us, given the cost pressures that we're now living under, I think it's important for us to be clear about what success would look like at the end of that pilot period, and how we'll measure whether the post is actually delivered value. I'm sure we have discussion about it. So.
Sue, did you want to cut? Did you hear that? And did you want to come back at all?
Yeah, yes. I mean, I think we know what we're aiming for, and that is someone who can reduce the pressures on the staff that are currently involved in dispersing charitable funds, but also can generate awareness of what charitable funds are for with the staff, and also can get into the space of doing some bid writing and fundraising, because we are aware that there are pots of money out there that we would potentially be eligible for, but we haven't got the capacity to ask for. And obviously, once we become more sure that we've got a sort of a space that's generating money, the more we can be more confident about offering money out. One or two people in the trust have said to me that in other places where they've worked, there's been far more emphasis on doing things for the trust charity. And I think that there is an appetite to raise money for us. We can see that our neighbours are doing fundraising very effectively, and sometimes they're doing initiatives which are in areas which are actually served more locally by, for example, our own hospitals. But because we're not out there in that space, they're able to sort of monetize whatever people would like to offer. So I think that there's huge scope for this role, and it will require a certain skill set, but it's going to be something that would really alleviate pressure on Robert and his team, who at the moment are doing lots of work to support charitable funds, but can't really go the extra mile to do some of the things which a really sustainable charity would be doing.
Thank you for that explanation, Sue. So I think, am I right in thinking that something more concrete will come back to the trust board at some point?
Yeah, so the trust board of the trustees.
Yeah.
Sue described a report of discussion with the trustees.
You. Everybody consent to? Yeah. Okay. So that moves us on to the reports. Done the verbal. Yes, the reports considered elsewhere. And these have all been through other committees, and they're mainly here for information. But I do need to ask you for approval for one of those, which is the framework for quality assurance and improved professional standards. And that, if we can approve that, because that then needs to be signed by Ellen and passed to NHS England. So can I just check that nods, so that's lovely. Okay, so just moving on through the agenda then, we've got no documents to sign or seal. We've had no advisory appointments committees to appoint any consultants. Any new items to be included on the board assurance framework? I think we've covered that quite thoroughly. So, That's okay. Any other business that anybody wanted to raise at all?
Got yours and I've got one as well.
Shall I go first then? So I wanted to just pay tribute on behalf of the board. Jill, sitting next to me. So I can't turn to what hand and just say. But I know if Mark was here, he would say how much he valued your support, your insight, your judgment. But I think that's actually something from the entire board that I think you have been invaluable. And I know that the procedure, it was planned to replace you. I think, as Ellen said, it's one person with many people. So I think that actually we need to record, just how tremendous your input has been, and how much she will be missed. And I can see that Angelica's sort of appeared. So yes, on behalf of the board, I think to give you a round of applause.
I've got one item as well.
Yeah.
As it happens, and also on a sort of I guess it's bittersweet, isn't it? It's a nice moment to say thank you very much, but also sadly to say goodbye to Janet. Many of you will know that Janet had a tremendously successful career, clinical career, and then after that came to us in 2019, I believe, as an ed, and has served on, well, not least Q&S and of course the board. And I've got some notes. Yeah. She's chaired Q&S, of course. She's supported the Medical Director Revalidation and Advisory Group. She's helped with Clinical Excellence Awards. She's been a member of Audit and REMCO. In addition, she's also joined the ICB Quality and Resources Committee. And finally, 2023 became Deputy Chair and has done a tremendous job in those times that sadly Mark has been unavailable, like today, where she's done an amazing job as our chair. So I think it's absolutely fitting for us to mark the moment and say thank you so much for everything you've done for the trust. Me, Vina, and a few of the others haven't been here the whole time that you've been here, but in the time that we've been here, you made a huge impact. You've been available for us as a mentor, as somebody we can go to and speak to freely, and you act with humour and informality when you need to, and you make yourself very approachable. And I think they're very strong hallmarks of a fantastic colleague. So thank you very much.
Thank you. Oh, thank you very much. I don't know what to say really, except, well, I will say that actually I didn't do that good a job actually chairing, because I realised I missed tonight. So I'm going to take that as read. I could feel Jill looking at me and I was thinking, what have they done, what have they done? But however, everybody needs a don't they? And I've got plenty of them. But yeah, thank you. I've really enjoyed my time here. I've had many roles, and I was reflecting, and I think actually this is the one I have enjoyed the most. And the reason I've enjoyed it most is that it's been lovely not to be operational, but it's been lovely to actually, be strategic and to operate in that sphere and have such amazing colleagues. And that's what's made it the best. It's the people I've worked with. I'm not going to pick anybody out, and some of mine here, but that's been the highlight. Has been working with such an amazing set of people, all been different, and have actually enabled me to continue learning through this role as well. So thank you very much. And I realise I didn't give Jill a chance to say anything. So I'm not going to have the last word. I'm going to let Jill have the last word. Jill.
I mean, I'm in the office for the minutes. We've got another leaving. Right.
Otherwise, it looks a bit sad, doesn't it? I mean, Jill has got a leaving to before anyone's worried. So,
but no, I'd just like to say how much I've enjoyed working here, and as you say, there's some amazing people in the organisation. I mean, this morning when we heard the story about Louise and the care, actually, Natalie said, she said to the parents, that woman up there is really hard, but you've got a tear in her eye. But yeah, loads of amazing people. I'm sure the trust will go on from strength to strength. So I'll look back fondly about my time here.
Obviously, Jill and I will be dialing in.
We will be.
So, as members of the public, so I'm going to say the date of the next meeting is the 20th of November, and Jill and I will both be watching the YouTube just to make sure.
I know I'll be in Perth, and I'm not sure if at that point the Ashes Fest has started, but I'll consider it.
Okay. So thank you very much, folks. Look forward to seeing everybody a bit later on then at the AGM. And the day continues. So very much.
Thank you, Janet.
Thank you.